Welcome to a very special episode of the COVID Law series. First, I want to say thanks to all of you who have been contributing and watching this series. This episode is dedicated to you. Yes, all of you who have been sending your videos, you're asking questions. On this episode, I'll get to address those questions with the help of a medical expert and a legal practitioner, of course.
This is the COVID Law series. This is the COVID Law series.
How long does COVID-19 last in an infected person?
It depends. It may usually last between 1 to 2 weeks, but it may last longer, especially when the level of immunity is low or people who have comorbidities. So it may last up to 4 to 6 weeks, and it can even be more, especially when you have a severe immunocompromised situation.
If I had COVID-19 and I am fully recovered, can I still get infected with the virus again?
Yes, if you have a COVID-19 infection and you recover from it, you can still get COVID-19 infection again, just like malaria. Because you survive from malaria does not mean you cannot have malaria again. Once the infection is introduced, the organism is introduced, you go through that cycle again.
Do I need to wear a face mask and avoid close contacts with people now that I'm fully vaccinated?
Yes. When once you're vaccinated, one is still required to wear the face mask because we have not attained the level of herd immunity. Until everyone is protected, that is when we can say we can go off face mask. And the reason is, vaccine is to prime the body to respond in case there is a new infection. So, and there is a time lag between the organism gets into the body and the time the body starts responding. So, and if the body doesn't respond in time, the organism starts multiplying in the body. So that is infection. So the same way somebody can transmit it. But the good thing is, because the body has been primed by these vaccines, in no time, the body will eventually respond adequately to take care of the virus. So that is why it prevents severity, vaccine prevents hospitalization, and it prevents death. It does not mean it may not happen in some few cases, right? That's why you have percentages of effectiveness or efficacy. We say 90%, 75%. It means there are still some other people who may not even respond to the vaccine at all for various reasons. So it's advisable when you take the vaccine, you still wear a face mask.
Do I have a right not to take the COVID-19 vaccine?
The issue of right to take COVID-19 vaccine or not is a personal decision, but it is also a public health decision. Because when you take it, it protects your health. At the same time, you also protect others, because if you cannot transmit the infection and you reduce the chances of transmitting the infection, you protect especially the vulnerable one. So it's also good that we take the vaccine so that we can protect our society.
Is it safe for my child to get a COVID-19 vaccine?
Well, you know, the study for the vaccine initially was carried out 18 years and above. But in some countries now, they have also approved some of these vaccines for 12 years and above, because they have also done trial in them. And they have understood how well it will respond in them and the likely side effects. And they have seen that it is safe. So some countries have started that policy. But Nigeria has not started. But I know that very soon, we may get to that level when we have enough vaccines.
If I have an underlying health condition, can I still take the COVID-19 vaccine?
COVID-19 vaccines is prescribed for almost everybody, except if the person is proven to react to certain vaccines. But then, irrespective of your condition, whether you have underlying health conditions or not, that it doesn't prevent you from taking the vaccine. But it's also good for the doctor who is managing one to do assessment and to advise the best time for one to take the vaccine. And they are the ones that even need the vaccine most, those who have underlying health conditions, because they are more vulnerable to the infection. So it's better you take the vaccine to protect you from the severity of the infection.
What is this COVID-19 variant people talk about?
Well, there have been always variants of viruses because the viruses have adaptation mechanism and they want to continue to survive in their environment. So because of that, they continue to change their properties to enable them to survive, either by increasing the rate of transmission, or either by increasing severity, or by moving to new hosts that have not been recognized to carry this virus. That's why sometimes some viruses are limited to animals before. Then over time, you start seeing them in humans, causing devastation. There are still others too who come into humans that they may not cause much problem, but it's a irregularity virus undergo transmission, variation from time to time.
Will the COVID-19 vaccine be effective on new variants of the virus?
For now, countries that have massively vaccinated their population have experienced significant reduction in infection as well as severity of the disease. So irrespective of the variants, and especially countries that have also reported these variants. So for now, the vaccines that we have seem to be working against these variants, but we still need further studies to understand better how vaccines can be more effective, or more effective vaccines can also be developed against the emerging variants.
What should I do if I have side effects after a COVID-19 vaccine?
Of course, for every vaccination, there may be some mild side effects like headache, some irritation in the site of injection, sometimes general weakness. These are common with all vaccines, and they are mild symptoms that disappear within a very short time, maybe 24 hours. So, but if one has severe reaction, more than these symptoms, maybe somebody is convulsing or serious headache, or somebody is down weak or going unconscious, and that needs to be reported to the authorities, our health centers or hospitals. Those who are given the vaccines also provide information where one can report to, just like the way we report our diseases. So this is also being done. So there is vaccine surveillance. That is reaction to vaccines. Allergic reactions and other types of reactions are being documented. So people are encouraged to report them so that we can further understand what kind of reactions these vaccines can cause and how better to deal with them.
Thank you very much to our medical expert. This is still the COVID Law series, and this special episode is dedicated to you. Yes, we are answering all your questions relating to COVID-19 and the law. Now let's move to more law-related questions. But before that, watch this.
BM, please can I get some palm oil?
Can you get palm oil from who? Am I selling palm oil? You are carrying palm oil to the front of your house. Come and buy palm oil. Even girl, as you enter, are you not supposed to ask money? No way, you lack courtesy. If not that way, you lack courtesy. You greet us, pay money, or how are you? You ask us anything.
BM, sorry.
Sorry for yourself.
Hope you are fine.
I'm not fine. Let me just tell you, that is simple truth. Simple truth. Because as I wake up this morning now, I see bang on my phone. Everything pay is salary that my people they want to pay. What do you see there? No, what do you see there? What do you see? Read it so that the whole world will see it. What do you see there?
Sorry, we have to let you go.
You will still ask them, let me go where? No, ask them, let me go where? They said they have to let me go. It means they have sacked me here. They have sacked me. You don't say you want to borrow palm oil. Where I want to see the palm oil?
I only ask for oil.
You only ask for palm oil. Even me, what they ask for government? Just peace of mind. Peace of mind. Because now they say they sacked me because of Koro. Do I know Koro before? No, me and Koro, what concern me and them together? Am I living in Obani Koro? Am I part of Obani Koro family?
Thank you very much, MC Lively, for that skit. And yes, it's not only Barrister Mike that is experiencing all these changes due to the pandemic. Several of you have asked questions relating to how COVID-19 has affected your employment relations, have created new legal liabilities, and even some human rights issues. Now, let's answer some of your law-related questions as I sit with Barrister Ebenezer Egwatu. Join me. So yes, people are asking questions around legal issues that relate to COVID, and we would go straight into some of these questions. This one says, can I, as an employee who has been laid off due to COVID-19, access my pension funds?
If it is COVID, the pension is yours, you are entitled to it, you should access it.
As businesses are facing difficulties because of the pandemic, is that a ground for my employer to fire me?
It is a valid ground. It's not just a ground. It's a valid ground.
It's a valid ground for them to fire you?
Yes.
No compensation?
No, firing doesn't mean you won't be compensated.
Right.
Except you are willing to work without pay. So if your employer sees that he can no longer pay your salary, and he tells you business is bad due to COVID, okay, we will not be able to sustain your employment any longer. We are constrained to relieve you of your services here. You go home. It is painful. It is one of the negatives of COVID.
Can I sue the person that gave me COVID-19?
But how do you know that it is this person, it is from this person that you got infected with COVID? The answer is you can't sue because you cannot, you will hardly prove it. It is also airborne. Have you been confined in that space within the past 10, 11, 12, 14 days? You never went to school, you never went to work, you never went to shopping mall, you never went out of that space. Was it only two of you? If you ever left that space that two of you are sharing, if you ever left it, you have lost that right to sue.
Right. You can't sue. Anyways, we have another question. This person says, what if they are exempted from wearing a face mask, but they work for an organization that enforces the requirement to wear a face covering or a face mask? What then happens?
If you are working for an organization, you are bound by the organizational policies. The law in Nigeria now generally require the COVID-19 Disease Protection Regulation 2021 requires that you wear face masks, you observe the COVID prevention protocols. So, but if for whatever reason you may not be wearing face mask or you are exempted from wearing face mask, first of all, you should have a letter of exemption saying, for so and so reason, which I suppose should be medical, this person is exempted from wearing face mask. Wearing face mask is one of the other protocols, COVID prevention protocols. The company work policy demands that you wear face mask. So you reason with the company. If they cannot accommodate you, they will fire you. Or you can, in anger, start up your own company.
Thank you, Barrister Ebenezer. We have another question regarding employment as well. This person says, as an employee, is it my right to decide to work from home? Do I have a right to say,
no, you don't.
Pandemic times?
No, you don't. If your organization requires that you come physically and work, you work. There are COVID prevention protocols. So you can insist that they protect you. You can insist that they provide you hand washing space. Yeah. You can insist that they provide you sanitizers. If the organization says you can even take it up, you can escalate it, you can report to NCDC, you can report to Presidential Task Force that your organization is forcing you to come to work without providing you COVID prevention materials or PPE.
Thank you very much, Barrister Ebenezer, for your time and your insights.
It's always a pleasure to do
the
this.
COVID law series. Yep, I would have said let me give you a handshake, but we have the elbow bump.
Oh, we can do this. We can do this.
All right, this is the package of this episode on the COVID law series. This special episode dedicated to you was to engage with all your questions, and I hope that your questions were answered. If not, keep the questions coming. Use the hashtag COVID Law Series, and engage with me on Facebook, Twitter, Instagram, and YouTube. If you want to ask a question, use the hashtag COVID Law Series. Till the next episode, have a good one.